Alcohol. Alcohol is one of the most widely used psychoactive substances in the world. It slows down activity in the brain and central nervous system, which is why people often feel more relaxed, confident, or less inhibited after drinking. However, alcohol also affects judgment, coordination, and reaction time, making activities like driving extremely dangerous. In the short term, drinking too much alcohol can cause slurred speech, poor balance, vomiting, blackouts, and alcohol poisoning, which can become life-threatening. Long-term heavy drinking increases the risk of liver disease, heart problems, several types of cancer, memory issues, and mental health disorders. Alcohol can also lead to dependence, meaning the brain and body gradually rely on it, making it difficult to stop without withdrawal symptoms. Nicotine. Nicotine is the main addictive chemical found in cigarettes, cigars, smokeless tobacco, and most vaping products. It reaches the brain within seconds and triggers the release of dopamine, a chemical linked to pleasure and reward. This is why nicotine can become addictive very quickly. Many people report feeling more alert or relaxed after using nicotine, but these effects are temporary. Short-term side effects can include an increased heart rate, higher blood pressure, dizziness, and nausea, especially in new users. Over time, nicotine addiction makes quitting difficult, while smoking tobacco greatly increases the risk of lung disease, heart disease, stroke, and several types of cancer. Even though vaping exposes users to fewer harmful chemicals than smoking, it is not risk-free, and nicotine itself remains highly addictive. Cannabis, marijuana. Cannabis, also known as marijuana or weed, comes from the cannabis plant. Its main psychoactive ingredient is THC, which affects brain regions involved in memory, mood, coordination, and perception. Because of this, users may experience relaxation, altered senses, laughter, or changes in how they perceive time. Short-term effects can also include slower reaction times, impaired memory, red eyes, increased appetite, and anxiety or paranoia in some people. Regular heavy use has been linked to problems with learning, memory, and attention, especially when use begins during adolescence. While not everyone who uses cannabis becomes addicted, some people develop cannabis use disorder, making it difficult to stop despite negative effects on their daily lives. Cocaine is a powerful stimulant that causes a rapid buildup of dopamine in the brain, producing an intense feeling of energy, confidence, and euphoria. However, these effects usually wear off quickly, which can lead some people to use it repeatedly in a short period. In the short term, cocaine can raise heart rate, blood pressure, and body temperature, while increasing the risk of anxiety, panic attacks, irregular heart rhythms, heart attacks, and strokes, even in otherwise healthy people. Long-term use can damage the heart, lungs, and brain, contribute to severe mental health problems, and lead to strong psychological dependence. Because cocaine's pleasurable effects are short-lived, it has a high potential for repeated use and addiction. Methamphetamine. Methamphetamine, commonly called meth, is a very powerful stimulant that speeds up activity in the brain and body. It is usually found as a white powder or clear crystals called crystal meth, and people may swallow it, snort it, smoke it, or inject it. Meth can keep a person awake and full of energy for many hours or even days without sleeping, which is one reason it has a high risk of addiction. In the short term, meth can cause a fast heartbeat, high blood pressure, overheating, loss of appetite, and trouble sleeping. Some people also become anxious, aggressive, or paranoid. Over time, meth can cause severe weight loss, damaged teeth, often called meth mouth, skin sores, memory problems, heart damage, and lasting changes to the brain. It is considered one of the most addictive drugs. MDMA, Ecstasy or Molly. MDMA is a synthetic drug with both stimulant and hallucinogenic effects. It increases the release of serotonin, dopamine, and norepinephrine, chemicals that affect mood, energy, and emotions. Many users report feeling unusually happy, emotionally connected to others, and full of energy. Short-term effects can include increased heart rate, sweating, jaw clenching, blurred vision, dehydration, and dangerously high body temperature, especially in hot environments or during prolonged physical activity. Some users experience low mood, anxiety, or fatigue for days afterward as brain chemicals recover. Repeated heavy use may affect memory and mood, although researchers continue to study its long-term effects. MDMA can also become habit-forming for some people. Heroin is a powerful opioid made from morphine. After entering the brain, it binds to opioid receptors that reduce pain and produce intense feelings of relaxation and euphoria. Because it strongly affects the brain's reward system, heroin has a very high risk of addiction. In the short term, heroin can cause extreme drowsiness, slowed breathing, nausea, and reduced heart rate. Taking too much can stop breathing completely, leading to a fatal overdose. Long-term use is associated with severe physical dependence, meaning the body adapts to the drug and withdrawal symptoms can be intense. Continued use also increases the risk of infections, collapsed veins, and damage to many organs. Fentanyl is a synthetic opioid originally developed to treat severe pain, such as pain after major surgery or advanced cancer. It is extremely potent, many times stronger than morphine, which means even a very small amount can have powerful effects. When used under medical supervision, fentanyl can provide effective pain relief. However, illegally manufactured fentanyl has become a major cause of overdose deaths because it is sometimes mixed into other drugs without the user's knowledge. Short-term effects include pain relief, drowsiness, and slowed breathing. An overdose can quickly stop breathing and become fatal without immediate treatment. Like other opioids, fentanyl has a very high potential for dependence and addiction. Oxycodone. Oxycodone is a prescription opioid painkiller used for moderate to severe pain, especially after surgery or serious injuries. It reduces pain by activating opioid receptors in the brain and spinal cord, while also creating a sense of comfort or euphoria in some people. Although it can be very effective when used correctly, it has a high potential for misuse. Common short-term effects include sleepiness, dizziness, nausea, constipation, and slowed breathing. Taking larger doses or combining it with other depressant drugs greatly raises the risk of overdose. With repeated misuse, the body can develop tolerance, physical dependence, and eventually addiction, making medical supervision essential whenever oxycodone is prescribed. Xanax, Alprazolam. Xanax, or Alprazolam, is a prescription medication mainly used to treat anxiety and panic disorders. As a benzodiazepine, it works by increasing the effects of GABA, a chemical messenger that helps calm excessive brain activity, producing a relaxing and sedative effect. People taking Xanax may feel calmer, sleepy, less alert, or have slower reflexes and difficulty concentrating. Using it together with alcohol or opioid medications can dangerously suppress breathing and increase the risk of overdose. Long-term misuse may cause dependence, and stopping suddenly after regular use can trigger severe withdrawal symptoms, which is why it should only be used according to a doctor's instructions. LSD, lysergic acid diethylamide, is a synthetic psychedelic drug that profoundly alters perception, thinking, and emotions. Rather than affecting physical energy or causing sedation, it changes the way the brain interprets sights, sounds, and sensory information, often leading to experiences that feel unusually vivid or dreamlike. Its effects may include intense visual distortions, brighter colors, altered perception of time, and powerful emotional changes. However, some users experience overwhelming fear, panic, paranoia, or confusion during a bad trip. Although LSD is not generally considered physically addictive, its psychological effects can be intense and unpredictable, particularly in unfamiliar settings or for people with certain mental health conditions. Psilocybin, magic mushrooms. Psilocybin is a naturally occurring psychedelic compound found in certain mushroom species commonly known as magic mushrooms. After it is consumed, the body converts it into psilocin, which interacts with serotonin receptors and temporarily changes mood, perception, and thought patterns. People may notice brighter colors, visual distortions, stronger emotions, and a distorted sense of time or self-awareness. While some report deeply meaningful or positive experiences, others may experience anxiety, confusion, fear, or panic. Scientists are currently studying psilocybin for potential medical uses under carefully supervised conditions, but using it outside those settings still carries risks. Although it has a low risk of physical addiction, its powerful psychological effects should not be underestimated.